So, 2 days of strikes from nurses over Christmas, and that could just be the start. The government must really be starving the NHS of funding, right? Right? Well, let's look at the numbers. This is from the independent health experts at the King's Fund, adjusted for inflation. In 2009, we spent £116 billion on the NHS. Now, by next year, we'll be spending £174 billion on the NHS. That is a 50% real terms increase on NHS funding. But if there's been so much more money going into the NHS, where has that money gone? Why does it not feel like there's been more money in the NHS? Well, we've got more nurses. From 2010 to 2021, the number of people per nurse fell from 166 to 161. The number of people per GP fell from 1,312 to 1,246. The number of people per medical or dental staff fell from 507 to 417. That's all data from the independent Nuffield Trust. And it shows that even with population increases, there are more nurses, doctors and other healthcare professionals per citizen. So more doctors, more nurses, more money. What is there less of? Well, that's a question that was posed by Ben Zaranko, an economist at the Institute for Fiscal Studies. He said that even compared to 2019, spending is 12% higher on the NHS. There are 13% more doctors, 10% more consultants, 11% more nurses, and 10% more clinical support staff. So why doesn't it feel like there are? More staff and more money over the last 3 years, indeed more money and more staff over the previous decade too. And yet services are getting worse. Waiting times are appalling. Why is all this money and all these staff not making things better? Well, here is perhaps a part of the answer. While cash and clinical staff has been rising, in one area staff have been severely cut. The number of managerial staff. In 2009, that sat at 42,509. By 2021, there were just 33,531. That's a drop of 25% in managerial staff. So why does that matter? Well, while it's politically popular to say we should have more and more frontline staff at the expense of the backroom, in reality that leads to huge inefficiencies within the system. More doctors and nurses doing their own paperwork instead of treating patients. Deployed to the wrong places without enough logistics staff to say where they'd be most effective. A clogged-up system devoid of specialisation where medical staff spend too long inputting data on their terrible IT systems and not properly deployed for their own skill sets. Yes, what other sector, what other employer would not have that investment in logistics? Well, I'm going to say something politically unpopular. Even when adjusted per head of population, the NHS, of course, has never had more money, never had more doctors, never had more nurses. But before we say it's time to pour ever more billions of taxpayer cash into the system, we might need to look at the least populist answer that I could possibly think of. Perhaps, just perhaps, the NHS needs more middle managers.